Wall Street's eyes were also on D.C. today. Treasury Secretary Steve Mnuchin and Fed Chair Jerome Powell testified today in front of the House Financial Services Committee to discuss the financial and the federal government's response, to the coronavirus pandemic. Joining us now to break it all down is Representative Warren Davidson, who is Republican from Ohio, member of the House Financial Services Committee, and was at the hearing. Congressman, I want to play you a bit of what Secretary Steve Mnuchin said about the administration's plans for PPP funding set to expire today. More than $130 billion in the fund left over. Let's just take a quick listen and we'll dive right in.
We do support additional legislation, and we look forward to working with the House and the Senate on that. As it relates to the PPP, I've already had conversations with the SBA committee in the Senate about repurposing that $135 billion and think that should be done, and look forward to working with both the House and the Senate so that we can pass legislation by the end of July.
And so in reaction to that clip, I just want to understand, do you support this idea?
Well, I think you look at money that's already spent, and I've got a bill that's similar for money that's already been spent and sent to the states. In Ohio's case, about $4.6 billion out of a total of 150 or so billion that was sent directly to states to help. And when you talk to governors, treasurers, legislators, local government officials, the problem is that they have more dollars than they can spend on the very tight constraints for COVID-specific expenses. And that's great news because that means not only is the pandemic not as bad as feared on the health crisis side, the cost of it hasn't been as bad as we feared. And you're seeing a similar thing on PPP. So as lots of people are rushing to spend even more money, I think the biggest thing that we need is flexibility and thoughtfulness on making use of the money that's already been spent.
I want to get your grade for the government's response to the coronavirus pandemic.
Well, if you're asking how we responded to the pandemic on the whole, I think there's a lot of opportunity to improve upon that. I think there'll be lots of PhD papers written on all of it. But from a public health perspective, we clearly could have done better. That's a big part of what we're working with the World Health Organization on, because it's clear they could have done better. When you look at the reaction to closing our economy, I think that's going to go down as one of the worst mistakes we've made in recent history. I mean, we essentially closed the economy. This isn't because of COVID-19. I mean, it was a root issue, but fundamentally governments chose in varying ways around the country to effectively close the economy. It's not like all this money that the federal government has appropriated, including the PPP funds, we're bailing out an industry because somebody did something bad. The government chose this course of action, and you see really spotty effects around the country. This shows up particularly in the commercial mortgage-backed securities market in terms of risks of defaults and delinquencies on properties. Same on tenants and multifamily housing. You see pockets where they're really in deep despair, and a lot of it's highly correlated to the decisions largely governors made, and they were not consistent. And in a lot of cases, they were pretty draconian.
You mentioned the WHO, and President Trump has been very critical of the WHO right now, and he has announced cuts to the funding from the U.S. And so as of right now, as we're watching the WHO also saying that we haven't seen the worst yet of the coronavirus pandemic, what should the United States relationship be with the WHO right now, from your perspective?
Well, I think the real thing would be to get to the root of the issue, right? So, what is the root problem? How is it dealt with? And you look at China, for example, they are starting to cooperate a little bit more, but in fits and starts and in really confusing ways. So, when you have an airline that crashes inside a country, there's an international team that responds immediately. And when that country refuses to cooperate and then refuses to hand over the black box, the whole world kind of goes, was it really an accident? And this is essentially was China's approach to COVID-19. They didn't want anyone to come in. They didn't want any outside input on it. They didn't want to share the information. They didn't even want to share virus cultures. So it really delayed the world's response to COVID-19. That's something we need to deal with. But I think the best way to deal with it is to start encouraging China to do something that maybe doesn't come natural to the leadership of China, which is to have a little bit of transparency. And the World Health Organization, rather than facilitating China's approach, should be facilitating the common denominator that's around the world. And I think when we get that right approach from the World Health Organization, you'll see the United States remain fully engaged in world health.
Some of the I won't say blame, but some of the attention that China has had placed on them, and especially right now from President Trump, who has continued to say that China is to blame at the root of all of this too. When you think about the way that he has discussed China's involvement or the origination from the virus in China and using, and oftentimes, racist terms, is the president right in doing that? And how do you and your Republican counterparts also speak with the president on an issue like this, understanding the race relations and the broader anti-racism movement taking place here in America right now?
Well, I think at a time right now we should definitely be united, and frankly, you would think from the reactions, the way the news coverage, and frankly even some of the way things broke down around the country, that there was massive disagreement, for example, about the right way to deal with the George Floyd situation. I mean, I live in a in nearly 90% white district, and we had peaceful protests in the most rural, least diverse parts of our district. There's overwhelming consensus that racism is wrong. That's why it stings so much when people use it as a pejorative today. But if you think about the president's language in referring to Wuhan, that was the naming protocol for viruses. You would say the Wuhan virus.
But the Kung flu was not
politicized. Democrats, no, just a minute. Look, Wuhan virus was, the Democrats in Congress chose the hearing name, and they chose to refer to it as a Wuhan virus back in February. It was only later that it became, oh, the president's a racist. And who would have ever heard that phrase? You know, you never used it about the president when he was Donald Trump, but once he filed for office, it's just been a relentless attack against him. And I think in a lot of ways it's very unfair.
I think, you know, we'll have to differ on that, because there are certain groups that would say that the president has had racist comments before and even in his campaigning up to 2016. And so that for a different discussion. But you did introduce a bill that I do want to get to earlier this month, loosening some restrictions on CARES Act funds given to states. Walk us through what this bill would do with the funding.
Yeah, so as I referred to when you talked about PPP, you know, this bill is called the Flexibility for States and Localities Act, or FSLA. And it basically says the money that's already been sent to states, hey, before we spend more money, let's make use of this money. And even if you do say, hey, we're going to spend more money, you still have to make use of the funds that are already there. So as it stands, local governments and state governments will have very tight restrictions on COVID-specific uses for these dollars. And they can't spend them all by December 31st of this year, which is the language of the current law. So this basically says states can decide to use them broadly in compliance with the law. They can violate Hyde amendments and contracting laws and any number of other laws that are out there. They couldn't use them directly to bail out pension funds or things like that, but they could use them to cover some of their other expenses that were higher than expected. And what most people are saying is the biggest problem is they've had a massive loss in revenue because they closed their economies.
All right, we'll continue to watch this very closely. Representative Warren Davidson of Ohio joining us here today on Cheddar. Thanks for the time.